Hello, everyone, and welcome to our event, Flipping the Script, a teach-in for healthcare workers on homelessness, pregnancy, and postpartum health. This event is co-sponsored by the NYU School of Medicine's Health by Housing Lab and Health and Housing Consortium. My name is Sean Wilkins. I served as the 2024 Health by Housing Lab Summer Consultant. We're so excited that you're here. This topic is important because when one pregnant person is homeless, at least two people need help at what could easily be the most crucial point in their lives. Today, we will hear from 4 speakers sharing how homelessness impacted their pregnancy experience and health. Next slide. Some housekeeping rules are, because this is a webinar, everyone is on mute and videos off. To enable and disable subtitles, select live transcript at the bottom of the screen. Please use the Q&A box, not the chat box, to submit questions or for panelists, upvote other attendee questions, and make comments. We will answer as many questions as we can during the Q&A portion, and the recording will be made available at a later date. Please feel free to join the conversation on X, formerly known as Twitter, using the hashtag flipping the script. Our X, formerly known as Twitter moderator today, will be Dr. Kelly Doran at Kelly M. Doran. I will now introduce today's event moderator, Veronica Addis. Veronica is the Chief of Obstetrics and Gynecology at Woodhull Hospital, founder and director of the Empower Center at Governor Health, which provides medical and social services to survivors of commercial sexual exploitation and other forms of sexual and gender-based violence. She is also the principal investigator of the NYU Empower Lab, a clinical research and advocacy lab that studies the intersection between sexual and gender-based violence and health. I will now turn it over to Veronica to introduce today's speakers.
Thank you so much, Sean. So I'm really honored to be here, and I'm so excited to hear from the panelists. I'm just going to introduce them by name, and they will then go ahead and introduce themselves, and I'll call on them again. So the 4 speakers are Kelly Beam, Shamika Anderson, Elizabeth Quintanilla, and Sophia Tate. Each of them is going to give opening remarks, and then we'll be doing some questions, and we'll take questions from the audience. So in order to get started, if Kelly, you could introduce yourself or do your introductory remarks.
Good morning, beautiful people. My name is Kelly Breen. I'm a licensed social worker. I'm a clinical case coordinator for pretrial services. I'm a member of Women's Community Justice Association, Justice for Women Task Force, and Beyond Rosie's campaign. I'm formerly incarcerated and a trafficking survivor. I have never spoken publicly about the details of my daughter's birth for 30 years. I have carried the shame, guilt, and pain and believed I was not worthy of compassion. Although my experience is my own unique journey, I share the lived experience of many impacted women, some silenced forever. The intersections of mental health, substance use, sexual violence, domestic violence, homelessness, and poverty play a role. The stereotypes, stigma, labels, assumption, and biases of the systems, including criminal justice, carceral systems, CPS, social services, and medical systems, play a role. I've had to learn to navigate the complex trauma and eventually learn to pay it forward and have compassion for myself and forgiveness. Academia teaches us one way. Real life is a very different scenario. My hope by sharing one of the most vulnerable parts of my journey is to highlight how words and actions of professionals can either perpetuate generational trauma or plant seeds of healing. Thank you.
Thank you, Kelly. That's so moving. The next person, if Shamika, you could give us your opening remarks.
Hi, good morning, everyone. My name is Shamika Anderson. I'm a 41-year-old single mother. I have been a resident of homeless shelters, both DV and family residents. I'm here today to address the importance of homelessness while expecting mental health and substance abuse treatment, the treatment that could be implemented or recommended while going through the system. I encountered many scary situations while going through the system. My goal of speaking today is to help others understand and see from the outside what homelessness, mental health, and substance abuse can do to mothers and families. I'm honored to be here today. Thank you.
Thank you so much, Shamika. Next, we'd love to hear from Elizabeth.
Hello, everybody. My name is Elizabeth Quintanilla. I am a 39-year-old mother of soon to be 5. I have been impacted by homelessness as well as the justice system. I have struggled and battled with substance abuse as well as alcoholism for a very long time, most of my life. I am currently in transitional housing through a program named Our Children. I'm from Queens. This program, I have been blessed by this program to be referred to NYU Langone. And my experience with NYU has been exceptionally amazing, comforting, and easygoing. I have never had a healthcare provider that has genuinely been so concerned of not only my physical health, but of my mental health as well. I am grateful to be able to share my experiences with everyone here today. And I really do hope that me sharing some of my story will better the medical field and understanding what a pregnant woman goes through when struggling and dealing with these battles in life. I thank everyone for your time today, and I look forward to being a speaker here today. Thank you so much.
Thank you, Elizabeth. And then lastly, we'll hear from Sophia, her opening remarks.
Good morning, everyone. My name is Sophia Tate. I am a 38-year-old single mother of 3, twins, 21, and a 5-year-old daughter. I am formerly incarcerated and have been home for almost 7 years. I'm a college graduate receiving my associate's degree from BMCC in liberal arts. I am also a member of a few different organizations like Osborne Association, Fortune Society, College Community Fellowship, just to name a few. I'm also a volunteer and advocate for social change. Right now, I am working on my bachelor's and for youth studies at CUNY SPS. Now, although the picture doesn't look so bad, let me tell you that the beginning stages of me being home was terrible. Being a pregnant single woman in the shelter, dealing with mental health, domestic violence, and also parole, because I did have parole stipulations, can be a lot. I've had many trials and tribulations while in the shelter system, as I did while in the justice system. Do I think it's fair? Absolutely not, no. But one thing I fought for was for perseverance. I maintained in my mind that I would find something suitable for me and my daughter and that we would be fine. But that wasn't all. There was a long list of things that I was going through on top of mental health, homelessness, and abandonment, and that was postpartum depression. Today, we are going to discuss these things, and hopefully, I can only hope that it can open everyone's minds up to the many things that happens to us women during pregnancy. Thank you very much for having me.
Thanks so much, Sophia. We're gonna go into some questions. I have some prepared questions for the panelists, and then those of you in the audience can start thinking about what questions you might have and put them in the Q&A box. But I wanted to start just a question for all of the panelists first, or whoever wants to answer this question. When you were receiving prenatal or medical care while you were homeless, did anyone from your medical team ask about your housing situation? And whether or not they did you feel comfortable sharing? And anybody who wants to take this can take.
I'll answer that. I find that when you start your prenatal care, a lot of the OBGYNs, their main concern is the pregnancy. They don't, well, my doctor didn't look into my situation of my stableness as far as where I was living or how I was living. And her main concern was me making my appointments. In particular, my firstborn, I was sleeping on the trains, pregnant. I was sleeping on Coney Island Beach, pregnant. In staircases, pregnant. And my OBGYN never knew that, because none of her questions was ever, hey, how's things going at home? None of her she's never asked that. And I think that's a very important question. How is things going at home? Because had she asked me that, I would have replied, I don't have a home. I'm homeless. So with that question, my answer would be, that's typically not a question that comes across when you're going through prenatal care. It hasn't been in my predicament. I have 7 children alive. I have 2 deceased, and not once have any of my OBGYNs ever referred to my living situation. I would actually have to come out and say, hey, I'm stressed out. I got problems. You know what I'm saying? So that's the answer.
Thank you, Shamika. I think that that's such a good point, and I think you're right. Most medical professionals were not taught to ask that, and yet if we don't ask, we don't find out. Anybody else want to answer that question?
Yes, actually, for me, the last 4 pregnancies that I had, I was never asked, how I was doing, other than, pregnancy wise. But with this pregnancy, I was released from being incarcerated last year in August. And the day that I was released, I came to Our Children. I was referred to NYU. I made up an appointment, and I was not pregnant at that time. But when I went for my primary care physician, that was the first question. One of the first questions that she had asked me was, how am I doing? And I said, oh, well, I'm fine. I am struggling with X, Y, and Z physically. She says, no, no, no. I mean, how are you doing? Like mentally, so then I did go into a little more detail and explain to her that I was incarcerated, and, I had the opportunity to be able to express some of my past experiences. But the line of questioning that she asked completely baffled me. It didn't, I didn't realize how impactful it was until after the visit. Later on, in the earlier part of this year, when I did get pregnant, and I did meet with my OBGYN through NYU, those were some of the first questions that they asked me was, how are you doing mentally? I see here in your notes that, you have struggled with substance abuse and homelessness, and, this X, Y, and Z is part of your situation. How are you doing with that? Are there any referrals or references that we can assist you with? And when I tell you, I was absolutely shocked. I have never had any kind of healthcare provider ever ask me or be so concerned about not just my physical well-being, but my emotional and mental well-being. And this, when I tell you, I have 4 different providers through NYU, and every single one has asked me in one way or another those line of questioning. And it has definitely eased a lot of my struggles that I deal with being triggered due to my past. And being able to feel comforted in the medical field, walking into a doctor's office and being like, oh, okay, I'm not going through this alone, or I have somebody who's trying to understand my situation. It is definitely a different ballpark for me. So I definitely understand, Shamika's viewpoint, because this here experience that I've had with NYU is completely polar opposite than anything I've ever had in my 39 years of life.
It's so great to hear an example of someone or an institution doing it well, because I think that's really aspirational for many of us, and to know what we can do to do that well. Did anybody else want to answer this question, or did you want me to move to more specific? Go ahead.
I'll be brief. For myself and my pregnancy with my youngest child, I will say that that was one of the first questions I was asked. I was very transparent about my situation, that I was living in a shelter, and that I was a single parent. I had already had 2 children already, and of I will say that they were very on top of it for me. I was dealing with domestic violence at the time. I was, I was in a place where I was like, I really needed the help. And one thing my doctor told me is, listen, if you need something from me, you let me know and I will make sure that you have it. So yeah, I definitely will say that that was one of the first questions I was asked was, listen, how are you doing? Are you okay? Is everything all right? The pregnancy wise, yeah, I was fine, but mentally, and emotionally and physically, I was drowning. I was going through a bunch of stuff. And, my body, it was taking a toll on my body. I had lost so much weight, and they synced it. It was like, okay, you was this weight when you first started, you dropping weight, fast. What's going on? You talk to me, tell me what's going on. And then he was so quick on it. They got a social worker involved. Like it just, and that, cause the place that I was referred there by a friend, and, they were very good to me. I'm not gonna lie, they were very good to me. If I could speak on my first pregnancy with my twins, but I mean, the thing is that I am glad that that was still kind of young coming home from incarceration. I hadn't really been home that long. It was less than a year. And like I said, I was able to talk about those things and get the help that I needed. So I'm really glad that I did have the type of doctors that I had at the time, that helped me through the stages that I was going through.
So glad to hear that. I want to go to a question for Kelly. Could you tell us about your experience of street homelessness while you were pregnant and giving birth? What was that like?
It actually kind of piggybacks off the first question you asked, so it'll be expanded. So I became street homeless after I became pregnant by my trafficker. When he found out I was pregnant, he beat me near death. And I was able to escape and run away to another part of the city. I did not receive prenatal care because basically I was at that point on a death run. So either my pimp is going to kill me or I'm going to OD. I lived similar to Shamika. I lived in abandoned buildings, trap houses, sometimes a park bench. The way I was scared to death of the hospital because I was scared my trafficker would find me. And I had been to the hospital before, and the way I was treated at the hospital before, I was also afraid of getting arrested. I was scared. I had no critical thinking skills at that point. Severe sexual violence, trafficked, mental health, substance use. But I had the critical thinking skills to go to the hospital when the labor came, thankfully. They did not ask me if I was homeless. They knew I was homeless. I had no insurance. I mean, you could tell when I came in again, I was street homeless, 90 pounds wet, severely mentally not well, and not in my right mind, I want to say. I had no insurance and they wanted an address when they did the intake for labor. And I had no address. I was not going to give my pimp's address. There was no emergency contact. So the time came to give birth. I was scared out of my wits. And I didn't know what was happening. I was starting to withdraw. I was scared of what was going to happen. And I asked the nurse to hold my hand as I was screaming and crying, and pardon me. She slapped my hand away and said, "Don't touch me, you're disgusting." And it continued. I was not given an epidural. Also, I did not, when my daughter was born, I did not see her. They did not show her to me. They did not say if it was a girl or a boy. The doctor proceeded to do the procedure to stitch without a topical painkiller. And I screamed, and this is word for word, "I don't have to deal with this shit," and walked out. And they all walked out and left me there alone. Flash forward, I woke up in a dorm setting, women similar to myself, withdrawing. They brought my baby, the social worker and the nurse. The nurse looked at me, the social worker looked at me and said, "You know what you did," and took the baby away. At this particular point, I believe I was there only a day. I was given a card for the Foundling Hospital, thank God for them. No talk of mental health, nothing. Just so you know, when I came out of the hospital, guess who was outside the hospital? My trafficker, who eventually sold me. And that's the experience of my first child.
Kelly, that's so devastating. And what I'm hearing in your story is so much stigma and so much mistreatment because of how you were judged. And I'm struck by this all the time because I hear stories like this so often from patients that I know how often that kind of mistreatment is happening. And it's hard for me to fathom because I know I would never say something like that. And yet I know that it's happening out there. And I think it's important for us to remember that, all of these behaviors that have traditionally been blamed on patients have now been shown to be very, very strongly associated with trauma and especially childhood trauma. And, there was a very judgmental attitude of healthcare around, well, these bad things are happening to you or you're sick because of your choices, because of obesity or because of addiction or smoking or depression, right? Or not getting care. And yet the statistical association is so strong and undeniable that we need to recognize that actually it's a classic trauma outcome and need to stop blaming people for all of these things that we've been judging. And it sounds like, this giving birth is already terrifying, but it was made so much more traumatic by you being treated that way. I think one of the things I find that even those of us who are very well-meaning, what we can be judgmental about is the attendance to appointments. And I have the feeling that it can be really difficult to attend prenatal appointments when you're homeless. Shamika, I was wondering if you could tell us a little bit about that. Is that something you experienced, and what were some of the obstacles to getting care?
Getting to appointments while being homeless is so crazy. There was one incident where I didn't have the car fare, and this is when the car fare was $1.25, and I didn't have a cent to my name. I hadn't even eaten that day. I was literally going day by day, making it with whatever I can get, and in these streets, they say beggars can't be choosers. So whatever I could get help with, that's what I accepted. And like Kelly, I have much respect for her. I was basically a target. I'm broke. I'm homeless. I'm young. I have no money. Oh, well, you could do some strange for some change. And I was so scared of that because of my family history that I literally ran from that. So basically, I was hopping trains, I was hopping buses. I was arrested 6 months pregnant because I jumped on the bus. And I'm telling this officer, I got a doctor's appointment. I'm high risk. I got a doctor's appointment. I don't have no money. So me being who I am, now I'm going to play it off. Hey, let me check my pockets. Let me see if I got a couple of cents I can throw it in the change bin. But I knew I did not have a cent to my name, but it's me trying not to get arrested because I just hopped the bus to get to my appointment. Long story short, I was arrested 6 months pregnant for $1.25 fare. He could have given me a ticket and let me go. I had no criminal history, no none of that. I'm 18 years old. This guy arrested me. And it wasn't like he was like, hey, I'm going to arrest you and, I'm going to take you to the precinct and I'm going to write you a ticket there. This dude sent me through the whole friggin' system, excuse my language. But it angers you when you speak on the situation sometimes. That was my first pregnancy. Coming now, I have Medicaid and I'm at my 5th pregnancy. And my doctor goes, Miss Anderson, you have a choice. We can give you a Metro card or we can call the cab, which is paid by Medicaid. So this is excellent for me because I'm feeling like, okay, I don't have to deal with asking somebody for car fare, and I don't have to deal with trying to bunch up a little, couple of dollars of change, during the week and taking out my other kid's mouth, to get to my prenatal appointment, The cab service that was referred for me, my appointment is at 10 a.m. The cab is coming at 10:45 a.m. I'm not getting to my doctor's appointment till 11:30. So the doctor looks at me and says, you have to reschedule. And I'm telling my doctor, hey, listen, you referred this cab service to me. I used it. This is being paid through Medicaid. If I have a 10 a.m. appointment, why isn't this cab at my front door 9 o'clock? 8:45, knowing that traffic is being ran through right now. These are major hours, right? You know, when people are traveling, getting to work, they're making runs, they're making deliveries. Why is the cab coming at 10:45 and my appointment at 10 o'clock? Can you please see me? Because I don't want to come back next week. This is important. No, no. So I bought my own car. And I didn't care that it was a hoopty. At least I know I can get where I have to go for the right and correct timing. And I didn't have to face having to reschedule. And I didn't have to face having discrepancies with my doctor, because my doctor is like, well, you knew you had a 10 o'clock appointment. Yes, I knew I had a 10 o'clock appointment, but you set the taxi for me. And these are taxis paid through Medicaid. Medicaid is paying them. So the problem is not with me. The problem is with the taxi service, and understanding that you're delivering patients and you have to be at a timely manner to deliver these patients, because we're on a time matter. So this is a whole discrepancy that has nothing to do with me, but with the system. With the system. Because even though they put a hand out and said, hey, here, look, this is a service that I can give to you, this service still rendered nothing for me, because I had to reschedule 2 or 3 times because of the same service, to the point where I said, I don't want it. No, thank you. So that's my story.
Thank you, Shamika. You know, I'm struck by, there's so many obstacles, and several of you have said that you actually have multiple children. So while pregnant, you're also navigating being a parent, and often a single parent. Elizabeth, I know that's the case for you. Can you tell me about that? How do you navigate that with other children? Juggle all of it, and how do they handle it? And especially that, you know, pregnancy is this exciting time, but it's also a bit of fear and stress.
Well, like I said before, like I mentioned before, I am in transitional housing currently, and the program that I'm with is Our Children. It's located in Long Island City here in Queens, and I would have never thought that homelessness would be made in a way to ease my struggles. This program, when I tell you, they hit every aspect of a possible struggle that I may possibly encounter or go through. This program is there. When it comes to transportation, if I'm in a bind and I need a Metro card, they'll give me a Metro card. The program, I live on 1 street, on 12th Street. 13th Street is not just mental health services, but I mean, they had a summer camp for the kids that kept them busy from 8 o'clock in the morning to 5 o'clock in the afternoon. So when I tell you that that alleviated so much stress, because I was able to make it to my appointments, you know, and with having a high risk pregnancy, you know, I am seen more often. But I mean, something as simple as a phone call. If I needed to make a phone call, my case manager is right around the corner between 12th and 13th Street. Her office is right there. And if not, she's just a phone call away. I call her on her cell. She walks around the corner and will come to the house. The food pantry is on 11th Street, right around the corner in the opposite direction. So when it comes to my appointments and visits, and this is not just appointments, you know, in the medical field, I mean, any appointment, they're there. So This, like I said, is the first time that I have had such an open experience with homelessness during pregnancy while still trying to raise two small children and making it to appointments. I mean, NYU is just amazing. If I can't, they always give me the option. Listen, if you can't make it in, let me know. We'll do a video call right through the app. If there's any concerns, text me on the app. Send me a message. I will get back to you immediately. It's just to have that opportunity that a medical provider has made my experience with pregnancy and homelessness and still trying to raise children at the same time so much more easy, less stressful. It's really mind-boggling to me because like I said, there's times where I'm like, I will get stressed out. I do struggle and I suffer with depression and PTSD and anxiety. So everything triggers me from the minute that I wake up. Smells, sounds, the sound of a door opening or closing. I mean, just anything can trigger me tremendously where I'll freeze. And, like I said before, the medical field with NYU has made it where I have the option that I can reach out. I can reach out. It's not the easiest thing for me to be able to reach out and say, I need help. I need some support. That is a struggle that I've battled with for my whole life. And when I tell you NYU has made that so much easier over the past year, I'm now at the point where if I am struggling, like this past week, I had some swelling in my hand, in my left hand for a few days. It would go and come. And I sent a message and she's just like, you know what? No worries. I'm going to call you on video. We're going to talk about it. We're going to discuss your symptoms. And then we're going to have you come in and we're going to have you checked out as soon as possible. And I said, okay, not a problem. That was such a relief to me because I didn't know I've never struggled with, the swelling or anything like that with any of my prior pregnancies. And when I tell you, she was on top of it, quick, so it was definitely, it's still a battle to, raise children and make it to your appointments on time. But when you have an amazing support system, it's all the more better. It really is. It's very, very comforting.
Inspiring. I'm struck by you talked about mental health challenges, and I think it's really important for us to kind of focus on that a little bit. In OBGYN, we have focused on postpartum depression for a while, but I think it's being increasingly recognized that postpartum anxiety is important, but also depression and anxiety and other mental health challenges while you're pregnant are very important. And I think that affects everything. It affects the homelessness, it affects the pregnancy, your ability to get care. Sophia, can you tell us about that? I think you mentioned it in your opening statement, and maybe some of the care that you received, and first of all, what it's like to kind of struggle with that, and then maybe the care that you received that either wasn't so great or maybe was helpful.
So prior to my youngest child, my oldest kids, I'll speak briefly on, I was a teenager. And I was going through a lot. My situation's a little bit similar to Kelly's. I am also a victim of sex trafficking. And it started for me when I was about 12, 13. When I got pregnant with my oldest children, I remember that I had the doctors and nurses, because I was a teenager and I was alone. My family wasn't there. how they also treated me. And I had no idea, because we, you know, even though mental health was going on around that time, I'm 38 now, so we talking about years ago when I was like 15 when I got pregnant. I was 16 when I gave birth to my twins. And even though mental health definitely existed, it wasn't talked about as much. I had no idea what postpartum depression was. I was still off and on with my sex trafficker as well, the pimp that I was with. And I remember when I finally did leave and I kind of recovered, I didn't know why I was always so down and depressed, and I was eating so much, you know. And I finally went back to school, to high school, and like I think I was there maybe like a week, and then I just like told my mother I'm not going back, you know. And in that time period I had went through so many ups and downs. That was with my first taste of homelessness at 17, 18 years old. Eventually my two oldest children ended up in custody care of my mother, which was very fortunate, very, very fortunate. I've seen different. A few years later, I became incarcerated. And even in that time, I was still dealing with postpartum. And I feel like that postpartum depression turned into something else, right? So all of that I battled. I went through stuff. Then I was going through incarceration, right? And all up until me coming home, right? And even though I had worked on myself while incarcerated, when I came home, it's a newfound freedom. I'm home. Oh, things about to be different. I came home with this drive, like I'm good, everything's fine. And then shit happens. Excuse my language, but shit happens, right? I ended up with my youngest child's father, and I was going through something that is now I'm not going to say it was abnormal, because I was going through abuse even in the situation with the trafficker. I went through domestic violence for the first time and while pregnant. And all that depression, those things started coming back, right? Everything started coming back. I being in the shelter, and even though I had good doctors, the therapist that I had, I don't feel like he was working. He was not working for me at all, because it felt like when you're in the situation when you're going through depression and stuff, with this particular doctor I had, it was like he was making it seem like the things I had went through was my fault. Me going to jail was my fault. The sex trafficking was my fault. Me having a drinking problem was my fault. The first time using drugs, everything that I went through, even the sexual assault while incarcerated, all that was my fault. I like asked for it, you know? So then after having my daughter while in the shelter, and going through the stuff that I was going through with that, and also with my daughter's father, that heap of postpartum, right? After reading up on it, I was going through it so bad that I tried to commit suicide. I checked out. I had checked out. My daughter might have been about 6 months. Found out that my daughter's father was cheating. I had literally lost it. And I had asked my mom one day, I said, you know, I know you raised my oldest kids, you know, and I would never ask you to do this, but can you watch Nzinga, who's my 5-year-old now? Can you watch her for a night? And she was like, yeah, you okay? That's all. It's like a light bulb went off. Like, are you okay? And that's what I needed, for someone to ask me, am I okay? And I broke down and I was like, no, I'm not. I'm dealing with something and I don't know how to explain it. And when I've been seeing a therapist now for about 4 years, right? And every time I go in her office, she says, hi, Miss Tate, how are you doing today? And I'm like, sometimes going on, I'm not feeling good, doctor, I'm going through it. And then sometimes I'm like, I'm okay today. That postpartum depression is a killer. And if you don't have someone that asks you, are you okay? It can bring about so much more on you. It's like a dagger, and it's like continuous daggers that stab you, you know, and you can't control it, and you can't control the feeling. It's harmful, you know. So it's very good to have somebody that can actually ask you, like, hey, you know, how you doing? Which is really all we actually be wanting, was for people to understand where we coming from. Hey, how you doing today? You all right? Is everything okay? That little sentence right there can change the monotony of a person's entire mood right then and there, you know. So yeah, that's how I handled, you know, my postpartum depression at that time.
Thank you for that. I think, you know, that experience is so common. And I think, you know, it's really a challenge. And I'm so glad to hear that you found somebody, a therapist that you trust, because a lot of people don't have that, you know, or don't click with the person they go to see. And it's just so important with mental health. And Kelly, I know you're a mental health worker, you're a licensed social worker. Having had lived experience, what do you do to support your patients, and how do you think that that approach is different from people who maybe don't have lived experience?
I'm able to see things from different perspectives instead of just black or white, because a person's a mosaic. We're pieces of a puzzle. So I'm able to meet my clients where I'm at. I'm also able to really channel the empathy and understand intersections. It's not one thing. And again, meeting a person where I'm going to say I and my clients are not defined by their worst day. There's something else to that person, and building a therapeutic relationship and celebrating strengths, not flaws. It's not a deficit. And that's the old way, the deficit. So I think I'm able to bring in like the academic foundations, but I'm also my lived experience. And, you know, again, we're not our worst day. I'm not my worst day. So, you know, and I'm able, although I don't disclose, but I am in community, there's representation. Someone sitting across from me and I have a shared lived experience, and there's hope. There's hope in a place that for many is very dark. And that's how I, you know, try to incorporate it into my professional and my advocacy work as well.
Thank you, Kelly. And I would imagine that even if you don't disclose, your patients probably, or your clients probably can sense the understanding. It probably doesn't even need to be said. I'm going back to the logistical challenges. I think, you know, being a parent and navigating all of this is a lot. And Shamika, I'm wondering how, you know, when I see patients, many of them have to bring their children to appointments, but often if they need to be admitted to the hospital, either for labor or complications, it's often a huge challenge to figure out what to do with children. What was that experience like for you? How did you find childcare? How did you navigate having other children while juggling all this?
Wow. I literally went through the scariest situations with my last pregnancy, and I was pregnant with twins. I was on the run from my ex-fiance. I was in a DV shelter. And it was horrible. Not only did this shelter state, they had all these big signs up on the wall We have daycare. No daycare providers, no daycare workers. If you need a respite, please contact your social worker, your case manager. No respite. Case manager is like, you're on your own. And then on top of all of this, I have an ACS case because of this dude. So my thing was to get somebody that I can trust to watch my kids while I go into labor. Bad enough, I already went through a very harsh pregnancy due to the fact I was carrying twins. And I was coming out of a DV situation, like I said. I had an ACS case that was very, 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 it was a heavy case. And the scariest part is, are they going to snatch my children again when I give birth? I fought. I got my kids back. I'm doing what I got to do. I'm getting away from this abuser. He can't beat me. He can't beat my kids. Okay, I think I'm in a safe place, but I'm not. Because at the same token, the shelter's not protecting me when it comes down to this. They're not helping me protect my children. I'm trying to protect my children. Now, who I asked to protect me and who I asked to hold my children, they're like, oh, okay, no problem, Shamika, I got you, girl, I got you, just send the kids with, the necessities that they need and, everything. And I'm like, okay, fine. And here it goes. The shelter is like, well, we need this person to fill out this package right here if you want them to watch your children. And it's like, hey, listen, I can ask them, I can request it, but I'm not sure they're going to go for that. So long story short, it went from not having any support, because like I said, I was on a run from my abuser. So it went from not having any support from the shelter at all, because every resource that they said they had was not in place at all. At all. Like literally, this was a DV shelter and all they had was the social worker there. Literally. You know what I'm saying? And I got this one person who I knew I can trust with my children, who I knew would be safe with my children. And now they're like, I'm not filling out those papers. I'm not giving all my personal information up like that. I want to help you. I want to be there for you, but I'm not putting myself in that type of situation where these people are now in my face, in my home, in my family. No. So guess what? Now I'm shitless, excuse my language. Now I'm nervous. Now I don't want my water to break. I don't want to go into labor right now. I have to figure this out. I have to find out a way to go into labor and be safe. It went to the point where I literally logged out of the shelter and stayed with a family member until I gave birth. For the simple fact that every resource that these people said they had was not there. Every resource. Literally. So now I have my child and I go back to the shelter, and they put a toddler bed in my unit. And I'm like, this is a brand new baby. I'm going to go bring my bassinet. And they were like, you can't bring your own property here. You cannot buy nothing. You can only use what we have. It's against the rules. It's against the regulation. And I'm like, but you gave me a toddler bed for a 1 week old. Really? Like, really? I gotta get a bassinet. I have an ACS case. If ACS comes here and see that my 1 week old is sleeping in a bassinet, in a toddler bed, do you know what can happen to me? So I've been through situations where the shelter will put me in more agony, more danger, more issues versus helping me out, to the point where I had to start advocating for myself. I had to start going to the higher ups. I had to start hitting up DHS. I had to start calling the ombudsman. I had to start hitting 311. I had to start writing letters. Now I'm dealing with other clients that's in the same residence as me. They're pregnant just like I was, and they're about to face the same issues that I've faced, and they don't know what to do. So at that point, it was like, hey, I got your back. I know what you're going through. I feel your pain. You know, I've did outreach and I've did motivational speaking before, and I did advocating for people who has been through the foster care system. I was a foster child. So with that being said, it hurt the heck out of me to know that I was going through this situation. I fought something my mother didn't do for me. I did for my kids. I made sure they wasn't in that system. I got them out of there. And the shelter put me in a very dangerous place to have them snatched right back. So being in the shelter, pregnant, and having the resources that you need while in the shelter, especially a DV shelter, because you are not allowed to tell anybody where you are. You are not allowed to call anybody from over there. You're not allowed to post pictures of your residence or in front of your residence, nearby your residence. None of these things. There's so many discrepancies being in a DV shelter. So how do you have so many discrepancies being in a DV shelter with no support? So that was my experience, and it was not easy. It was not a pleasing. It was very traumatizing to me. It made my PTSD worse. It did cause me to go through postpartum depression. It caused a lot of issues for me. But thankfully, as Sophia said, I have a great therapist and he helped me get through it. But sometimes going through these shelters, it's traumatizing because they don't have the resources that should be implemented. Thank you.
Wow, Shamika. I mean, that is so overwhelming. And I'm also, though, really impressed at your resilience and self-advocacy, because so many people in that trap, in that hole, wouldn't have had the wherewithal to do the kind of advocacy for yourself that you did. And you were your own hero. Many people don't think to call everyone that they can, call 311. Many people don't speak English, right? And what are they going to do, knowing that there are resources out there? So your example is incredible, but you shouldn't have had to do that, right? And there should be a much stronger system in place. It's wild. I mean, a DV shelter is going to have pregnant women, and then they gave you a toddler bed, which is a setup, like you said, for ACS. It's and then preventing you from getting the correct safe sleep materials that you need. So I think it's, it's really compelling because we also have to remember that pregnant women are also often parents, and that comes along with that. The other thing I want to point out is that you mentioned that you're thinking, oh my God, I hope my water doesn't break right now because I don't know what I'm going to do. We're in the midst of a maternal mortality crisis that we've been ignoring for decades. And women are often faced with refusing care and not being admitted. And I've seen it happen because of the safety of their other children, right? They're giving them effectively a Sophie's choice, right?
Yeah.
This baby or your current children. And I find that terrifying. And I have seen patients leave the hospital just because they had no childcare. And I'm worried that they're going to be out there with an infection or a stroke. And that's exactly what happened to you. So by not paying attention to these social aspects and logistical aspects, we can't provide the medical care that people need in order to be safe. So, I mean, your story just had so much resonance, and then just straight up bureaucracy, right? That at every turn you hit this unfeeling bureaucracy. I wanted to just turn to some of the audience questions, which are really great ones, and people can keep putting questions in the chat. Diana Rosenthal asked, do you think that providers would benefit from a standardized toolkit to assess one's complete health and well-being? For example, mental health, housing, and referrals needed. And I think the crux of that is, how is it done for you? Do you think a standardized toolkit as opposed to a conversation that many of you mentioned, like, how are you doing? What would be the best way that healthcare providers could go about assessing those needs? Go ahead, Kelly.
Yeah, I was gonna say, I mean, we all have the biopsychosocials, but I think learning, and that takes experience or a standardized toolkit, but also having a conversation. You're talking to a person, and the systems perpetuate dehumanization. So every system does. By perpetuating dehumanization, again, it's not acknowledging. And it's also scary because, again, systems are systems. We heard Shamika talk about CPS, and both Elizabeth and Saya, we've all know what I'm talking about. It's scary. You're asking me these questions. Why are you asking me these questions? Some people won't answer because they're afraid of what the outcome is. They're going to take my child because I have a mental health issue. They're going to take my child because I'm homeless. They're going to take my child because I have a substance use, instead of having a conversation and humanizing the person and you're not there to harm, you're there to help. And again, we've come a long way, but stigma, labels, assumption, and bias are very alive and well. And it's presentation. A standard toolkit is great, but presentation, it goes hand in hand.
Absolutely. Any other thoughts from the other panelists? I think just to build on what Kelly said, and especially because you traverse both the world of a patient and a provider, the system is so cold and unfeeling. And I'm sure that so many of the people who are attending this are learning so much about how to be a compassionate individual. And I think many of you've shared experiences that are negative and we should avoid, or positive and we should emulate. But that's on an individual level. And yet we all work within a system, all of us in healthcare. And the system exists with things like appointment times so that we can get through a large volume of patients. And yet, as Shamika pointed out, those structures that we've built to be able to function often prevent people with so much going on from accessing care and being safe. And so I would love to hear ideas from all of you, not how an individual can interact with you, but what are things that you think the system could change, either for everyone or for specifically an individual who's pregnant and experiencing homelessness, to better meet their both healthcare and social needs? How can we do this on a systems level?
In perspective to that question, I'm trying to figure out how to say this. um, Respectfully, I think that these entities need to start pulling in people who have actually experienced these issues. There's certain situations that a textbook cannot teach you. Black and white cannot teach you. You can have your master's, you can have your bachelor's, you can be a doctorate. I mean, it you cannot understand and you cannot feel the fathom of a patient or a client if you don't know where they have been or where they are coming from, their walk of life, their manner of seeing, hearing, thinking. My thinking is not your thinking. The way I walked in the valleys that I walked through, you've never seen them. So you wouldn't understand my prospect or why I'm coming across to you like this, because you've never dealt with that before. You've never seen that portion of life. You've never been through that valley. You've never walked down that block. You don't know about that tunnel. So you're like, hey, I just go around the block. And I'm like, nope. I go through there, I turn left, dip right. Yeah, I might go see Kevin at the same time. And you're like, oh, wow, you going through a lot. It's a difference. It's such a difference. And I think that providers need to have more empathy when it comes to these things, as Kelly said. And not only empathy, respect. Respect goes a long way. Hey, I'm not asking you to kiss my toes. I'm not asking you to bend over backwards. Just give me that same cordial and mutual respect that I give you. We don't have to like each other. We can disagree to agree. We can agree to disagree. I speak to you with mannerism. You speak to me with mannerism. Respect. If you don't understand something about me, say, hey, I don't understand. Can you explain to me? Empathy. Think about it. Okay, this person is telling me something I don't understand, but let me at least try to fill in with it. Try to understand a little bit of where this person is coming from. Respect. Remember that your patients also have dignity. It doesn't matter what we go through. Believe it or not, all of us ladies here has been through so much trials, tribulations, trauma, and drama. But I can promise you, we still have dignity. And our providers need to remember that when they deal with us. Thank you.
Absolutely. Did anyone else want to say anything for this question?
No, I'll just piggyback off of what Shamika said in reference to and Kelly talked about with empathy. It's hard enough that women are going through what they're going through with pregnancy, with any other um side things that they're going through in their life. And then to have someone that that basically is supposed to also care for your body, help you because you're caring for your body, but to be there to tell you if there's something wrong, like if you're hurting, or to help you, and they're doing more harm than helping. It's like, okay, so who can I trust if I can't even trust to have a conversation with you? And you're supposed to be my provider. You're supposed to be the one that's listening to me when I'm telling you my care and concern in life. I can't even come to you. It's devastating. And I mean, I'm firsthand. I mean, I have a doctor now since I've been home, right? And when I real quick, for a long time I didn't tell him the stuff that I was going through. For like maybe 3 years I was missing, right? And he was like, "Hey, where you been? I ain't seen you in 3 years. What's going on?" And I finally just sat down and told him like the stuff that I was going through. And he's one of the first male doctors, because I've always had female doctors. He's one of the first male doctors that I felt comfortable enough to tell him all that I was going through. And not one time did he interrupt me. I think I sat in the office for an hour with him and talked to him about the things that I had gone through. And I have he's a little Indian doctor, right? And he's so funny, and he's older, much, much older. He's in his 60s. And he used to get on, because he got at me. He howled and screamed at me because he was like, "I ain't seen you in 3 years. Where you been?" And I broke down crying in the office, and I was like, "Do you have time?" And he said, "You're my last patient. Talk to me." And I just was telling him all that I was going through. He said, "What type of doctor would I be to not listen to you, to tell me what you're going through?" And he was like, "I'm really sorry that you came home after doing all this time. You came home, you had a child, and you went through this abuse. You're still going through abuse," because at the time I was still going through it. You're still going through abuse. And all you want is just some freedom. You just want to live in peace. You just want some peace. And you couldn't even get that with the mental health professional you had at the time. So all that was just stayed bottled up. And what happens is when it stays bottled up, it combusts after a while when you just had it. And I was getting to that point. And I'm glad that we had a chance to sit down and talk to him about it, because I feel like had I not been able to talk to him about it at that time, who would have known what would have possibly happened? It's all about us being able to get out the things that are sitting combusted. I mean, that are sitting on our chest, that's sitting in our core before it combusts. Being able to not harbor those things that are sitting on our core, and being able to reach down, pull it out, and discard of it. And it's not easy to do that when you by yourself sometimes. Sometimes some people are able to do that. Sometimes you're not. Sometimes you need that extra push, that extra listening ear to do that. So I'm grateful that I did at that time, that I had somebody to do that with. Thank you.
Thank you. It's amazing that you found this person who really saw you three-dimensionally and was there to just give you that time. And I think that's what we mean by respect, I want to go to one of the audience questions. Heidi Schmidt asked, what communication needs to happen between the shelter staff, healthcare workers, and or doulas to create a holistic care team?
That's the major problem, Veronica, is a lot of these shelters do not have healthcare staff on their roster. This is the scary part. It's great that Elizabeth is in transitional housing where she's getting so much support. I'm happy to hear that, because 80% of the shelters that is ran by DHS does not have any healthcare providers on site. And their staff are so, I don't want to say uneducated, but they're so misinformed about the referrals and the references to guide these clients to healthcare that the client is basically left on their own to seek any healthcare, mental health care, drug treatment, everything. They're left to seek this on their own because these staff are so misinformed and they are not trained, or they're not what do you call, they're not in communications with the organizations, because there is a lot of organizations that does work with these caseworkers if they communicate, but they don't communicate. They come, they do their roster, they make sure you sign in and out, they eat their lunch, they go home. I got a home. I'm going to my bed. You the one in the shelter. It's your problem. This is how they address these type of situations. So getting healthcare in DHS is very minute. It's very scarce. My last shelter stay, it had a guy. He was there. And I'm going to tell you this story. I'm not going to go too far into it. He was using drugs. And one of the staff knew. She could have referred him to a drug program. You know what she did? She called ACS. She reported it. They snatched the kids. I see this guy at the train station. He ain't changed his clothes since the last time I seen him, and that was 6 months ago. Now, why do that when you could have helped this man fight his battles? Why do that when there's so many resources out here to help these families? ACS is not the answer or the reply for everything. It's not. It's not. You don't know what a person may be going through. Why am I getting high? Why am I drinking every day? Why am I smoking 2 packs of cigarettes every day? You don't know why I may be taking these actions. And because the healthcare system is so low in average in DHS, these issues are not addressed properly at all. So what should they do to address the healthcare of these clients or patients? I would say get the healthcare providers in there first. Get them in there. Start opening up triage clinics in these residencies. Start getting some registered nurses in there. If you cannot open up a triage or a registered nurse there, then you can have a base where the social workers can refer these families, these people to services. I'm just a speaker, right? Do you know how many people I have referred to drug treatment. And these people are paid by the hour to do this. And I'm doing this because I know what it is. I'm 13 years clean. I have not touched no cocaine. I have not touched any weed. I'm 13 years clean. But it was not easy for me. And guess what? Even though I'm 13 years clean, every day is still a battle because trust me, temptation and the devil is out here. Okay? So with that being said, what can y'all do? Get these clinics rolling. Get these clinics
It sounds
rolling.
like you're talking about co-location, right? And that goes back to the systems question of, instead of making the patients come to us, we go to them and make
That
it
too.
easier, right?
Basically, what is it? Listen, I work for the visiting nurse service. My patients don't come to me. I
Yeah,
pack
that's a
my
great
bag.
model.
I have my cuff to do my blood pressure. I have my thermometer. I got my stethoscope. I go see my patients. So why can't we help these people that are already needy and go visit them?
Yeah, absolutely. We have 5 minutes left. And so in that, I wanted to ask another audience question. And maybe Elizabeth, if you don't mind taking this first, since you've kind of told us that you've had a positive experience and a negative experience, that many patients might, this is a question from Sharita Sims, many patients might be reluctant to disclose all of the things that are going on with them. So Sharita's asking, what advice would you give to providers to help patients or clients overcome the fears associated with detailing the full scope of one's well-being? What safety mechanisms should be put in place, either from the negative experience that you've seen or this positive experience that you've spoken so openly about?
I would have to say it would begin with just a healthy way of communicating. You know, definitely like Shamika said, if there would be a way to get more of the medical field out here and doing field work, it would help them better understand a way to communicate with so many individuals that are triggered by certain words. Somebody may say something to one of us and it immediately puts us where we put up a wall. We feel that uncomfortable space. It brings us back. It jolts memories. It triggers us. Um, and definitely if the medical field could find a way to really get down and dirty into the streets and really do some serious field work. You don't always have to communicate verbally with someone. Sitting set next to someone who is triggered, you know, and sitting there for 2 or 3 minutes until their anxiety comes down can be comforting, so that they know that they're not alone and they're not going to be pushed or forced to do something or say something that they don't want to do, you know. So I would definitely say communication would be the largest aspect. You can communicate with somebody physically, mentally, emotionally, um, verbally. It's communication has got to be the biggest stepping stone to really getting people to understand that we're not alone in this. And the medical field is a resource that we can use in so many aspects that it's very um it's definitely comforting and soothing to know that the medical field is expanding their horizons and that they're trying to really reach out to the community, men, women, children, and especially women that are pregnant or mothers that are, you know, coming home from incarceration and they're jumping back into motherhood after 2, 3, 4, 5, 15 years, you know, I mean, postpartum depression happens even if you're not pregnant with a newborn baby. Jumping back into motherhood with 2 small children is a real thing, you know. So communication, I think, would be definitely a major stepping stone.
Thank you. Did anyone else have thoughts about, how can we do this? How can we approach it in a way that makes people comfortable, maybe disclosing some of those things that feel more vulnerable? Or not, if you don't have any thoughts on that. That's fine. There's so many good questions in the chat, but we're coming to the end and there's been so much insight here. I feel like I could go on for another 2 hours because you just all have a wealth of lived experience and knowledge. I think, before I turn it over to Sean for the closing, I really want to thank you all, Kelly, Elizabeth, Shamika, and Sophia, for sharing all of that and really honoring us and the whole audience with your experience. I would imagine that it's really hard to talk about, and that it brings up a lot of feelings, could even be triggering. And so it was really, honestly, brave of all of you to do this. And I think that you're doing it for the greater good for all of us and then the patients that we see. And so I feel really honored and I really thank you for being willing to share. And I know, I have hope for the future because I have a lot of students. One of them is in the audience and I'm very proud of her. She's now a medical student. And I hope there are a lot of students on this call because they're the next generation and they're so much better and more compassionate than my generation ever was. And so I hope many of them are hearing from you so that they do it right from the beginning. Because the experiences you're talking about, many of us were trained in previous generations where nobody talked about this. So I do think that these speaking experiences that you're giving as experts will help influence the next generation who will go on to do even better things. So I really thank you for giving them that opportunity. And I'll turn it over to Sean now to do the closing.
Thank you so much for your participation, everyone. The event was amazing. I'd like to thank the Health by Housing Lab and the Health and Housing Consortium and all of our amazing panelists and moderator for making this event possible. Thank you so much for joining, and we look forward to seeing you at our next event. Thank you so much.